Hello, everybody, and welcome to episode 43 of the Statecraft, the second episode in season 4, which we kicked off a few weeks ago. Really excited for today's conversation. I will introduce our guests in a little minute or two here. My name is Sammy. I am one of the founders of Certicraft and the host of the Statecraft. Certicraft, our business, is a compliance platform. We make the headache of Health Canada and the CRA go away for licensed producers in Canada. If you feel a lot of headache around that, reach out to us. We are by far the easiest system to use in Canada. That is the only ad you'll hear this entire time. The rest of this conversation is going to be a nice discussion without any corporate influences, so to speak. I like seeing you smile there, Kayla, at my silly comments. The Statecraft is a podcast that we started a few years ago because we were really frustrated that like all of the companies out there that had these like video webinars, it would be like a 5-minute discussion on whatever they advertise and then 45 minutes of an ad for whatever they do. And it was just like it was so deceitful and just so much disappointment all the time that we felt that we just wanted to do something a little different. And because of all the challenges that existed in the way that cannabis was regulated and all the policies around that on both provincial, federal, and local levels, we thought that creating a series where we interviewed people about their experiences to learn about what's going well, what's going badly, and what we can do differently in this space to result in an industry that was actually fair and just and allowed small businesses, independent mom and pop shops who weren't giant corporate interests, allowed them to actually thrive, that was a really important thing. So that's kind of where this podcast started. And season 4 now has evolved a little bit. One of the episodes we did in season 3 was really focused on the BC LDB and their proposed direct delivery changes, which did nothing to address the directive that was given to them by the BC government. In fact, it made things worse for small scale producers by offloading costs onto small producers while still charging them a 15% tax. I'm going to call it a tax. That's what it is, even though they don't call it a tax. And so we created this episode of what can we do? How can we like stop this from happening? And I spent the next 6 months after that episode just implementing all the things that, or 2 of the things rather, that came out of that. Ended up setting up a standing meeting every half year with all the ministries that touch cannabis in BC, and some good came out of that. Some of it's still ongoing. It's been taking years, which has been really frustrating. To the slowness of government is really frustrating sometimes. But this season, the intention was, if we did that from one episode for one policy issue for one ministry in one provincial government, what would happen if we instead had a whole season trying to address the system as a whole instead of one episode for one issue? So that's kind of where this season came from and what we're doing. We released a white paper that I wrote that's kind of our position paper, so to speak, on what is Certicraft / Sammy's opinion on how the cannabis policy landscape look and what kind of policy reform we think is important. And then this season is all about bringing guests who are experts in each of the things that we discussed in that paper, to come and have a discussion around it and just kind of get deeper into it and come up with solutions. At the end of the season, I'll be creating an action plan based off all these discussions, and that's kind of the general format, impetus, vision for season 4 of the Statecraft. So that's just kind of some context there. Before introducing our guests, I'll just say that the chat's fun. If you want to chat, please chat in there. If you have any questions, there's a dedicated questions tab. You can click that and ask your question in there. And then we'll, at the very end, go through any questions that have been asked. The last thing I'll do before introducing our guest is a land acknowledgement. So I live in Nelson, BC, and where I live here, I barely ever see any Indigenous people, and I was always very curious about that when I first lived here and asked a lot of people about why don't I see the Sinixt people, whose this is their traditional territories. This is um, where they've had their land for their culture for many, many, many thousands of years. Um, and eventually, I met somebody who was working with the matriarch of the Sinixt people here, and she had an answer for me, which was murder. There was there is a pretty big scalping program that was running here. There were many dams that were built that completely destroyed all the agricultural land that the Sinaiaks used. There was a whole bunch of series of things, both on small, like person-to-person levels and on systemic levels, that took a culture of thousands down to less than 10 in this area here. And I think it's really important wherever you are to, as a first step to any meaningful reconciliation, to learn what happened to the first people on your land. Um, there's many First Peoples across Canada who've had really horrible stories, like the Sinixt here, especially the matriarchal ones. Those are the ones that tended to be murdered rather than attempted to assimilation. The church just was not really down with women in power. I get the sense they still aren't either, but I can't really speak to that. Don't stay abreast of the church's happenings. um, but yeah, I also encourage you, if you ever do a land acknowledgement, put more thoughtfulness into it. It's just saying, I live on this land, and these are the people who lived here. Thank you for stewarding the land. That's like, I hate it so much when I hear those kind of acknowledgements, because it's like, these people have been murdered. They're not stewarding the land anymore. Like, you're just saying this thing because you're trying to check off a box, and it's just like, it has no real meaning behind it. It's just like, I checked the thing off. Like, let's have real discussions. Let's get people thinking. I think that's really important. And if somebody feels like really yicky, that's a good thing. We should be feeling yicky about like what's happened here. So anyway, I'll stop my rant, and we'll bring we'll bring Kirk and Kayla on that very positive note into the fray here. Hi, Kirk. Hi, Kayla. Thank you for being here. Oh, Kirk, we can't hear you anymore. I think you hit the mute button on your end. I can see you are muted. There we go.
Am I off? Okay, there you go. Hi, Sammy.
Yeah.
Thank you. I'm in Dauphin, Manitoba. I'm on Treaty 2 land. So from our land acknowledgement, I won't get into the rant, but I too understand what's happened. I spent many decades working within First Nations communities. So
Okay. Cool. Welcome, Kirk. Since you're talking, I'll ask you to introduce yourself first. Could you tell us a little bit about both your nursing history and your professional career, and I'd also love to hear about your relationship with cannabis and how that entered your life and what role it plays for you.
thank you for that. Well, I've had a 50-year relationship with cannabis. I grew up in British Columbia. I remember the 60s. I was too young not to remember them for obvious reasons, but my time was the 70s. And junior high school, cannabis came into my life, and I used to spend many hours down at the beach, a place that people that live in Victoria might know, a place called Arbutus Cove. Used to go down there, sit on the logs, and experimented in learning about cannabis. I became a nurse by accident. I was going to become a paramedic. I wanted to be a paramedic. I'm of the age of Squad 51, and the boys in the paramedics in the TV show. And my father made a suggestion that nursing would broaden my opportunities. So I went into nursing. Okay, Dad, I'll go into nursing, and basically stumbled my way through it. I wasn't necessarily the best nursing student, but I got through it and ended up teaching paramedicine later. Very shortly after I graduated, I went into Northern Alberta. I got an opportunity to work in emergency nursing. From emergency nursing, I got into being a paramedic. So I became a paramedic, and there was a college in town, and I became a professor of paramedicine. And one of the few at the time, I helped usher in the paramedic curriculums in Alberta and the nation. Um, I went out and got a whole bunch of certificates. In my career, I can wallpaper a wall with my certificates, and that's just because I was interested. So I just go get a merit badge, get a merit badge, get a merit badge. Long story short, I thought I'd get into management and fell off that career ladder because I was prepared to give leadership, and they wanted management. I'm not a
Mm.
manager. Um, but I ended up working in the north, in Manitoba, as primary care and nursing stations, and that was my dream job, was to be a nurse practitioner. I never made it to the nurse practitioner level, but I did get an opportunity to work in primary care access. So as a registered nurse, I kept communities as large as 10,000 people, giving them 5,000 people, 10,000 people. Some of the communities are quite large, but we gave them primary care access as nurses. So
Mm.
I'm very passionate about the politics of nursing. So I'm also very much involved with the board level with the Canadian Association of Self-Employed Regulated Nurses. So I have a little bit of a political platform on nursing. My relationship with cannabis, well, like I said, I was 15, 14. I was young, discovered cannabis. And to be honest with you, I felt as a teenager cannabis was safer for me than alcohol. Alcohol was not good for me as a teenager. Cannabis helped me. As a nursing student, for those of you that are from Victoria, I practiced in the old Victoria General Hospital, and it still had open windows and stuff. And I can remember being on the orthopedic floor one morning and walking in and smelling cannabis. So this would have been 1982, and I can remember the smell of cannabis and came out. Oh my God, the guy that's hooked up to the orthopedic, pulley system because he broke both legs, femur fractures, was consuming cannabis in his hospital bed. I thought that was, my God, that's amazing. Everybody pretty much ignored it. Nobody wanted to talk about it. And pretty much that's what cannabis was for the rest of my career. I can remember reading a study by Melody Dreyer, a Jamaican study about, she was a registered nurse PhD in Jamaica, and she was studying cannabis tea on prenatal ladies. And I can remember reading that study and going, look at guys, cannabis is medicine for people. I can remember when cannabis became medicine, and I was practicing as a nurse, trying to raise a family, trying to climb career ladders and all that sort of stuff. So I never really got into the cannabis space as a professional. I just was aware of it. I've always been a recreational user. It was about 7 years ago when Trevor tapped on my literally.
Oh,
Oh, we lost
did you?
sound.
Yeah, we lost sound. Did you, did you unplug the thing? You just click the mute button as well. The the mute you didn't press the mute button at first. It just like cut off. Okay, so Kirk was about to start sharing about reefer madness, madness, excuse me, reefer madness. um, so we'll pick that back up there once you're able to get sound back. In the meantime, Kayla, can you
Yeah.
introduce yourself? And same question, what's your history with nursing, and how did cannabis enter the picture for you, and what role does it play in your life?
Yeah, thanks for having me, Sammy. I'm in the Edmonton, Alberta area, and I'm excited to be part of this conversation because for me, cannabis didn't come into my life until I needed it medicinally. I held every stigma. I held those stigmas that the Dare Bear taught me that, it was bad. And like, I grew up in this really small rural farming community, and it was just like, the delinquents, they're the ones that weren't going to amount to anything. They're the ones who used cannabis. And so I left Riley, Alberta, moved into the city and started nursing school. And the reason I went into nursing was because of my aunt, who had a huge influence in my life. She was one of the most caring, compassionate women that I've ever known. And like, just for the touch of her hands, you knew that she could care. And she took me into Edmonton on a shadow shift in the emergency room when I was in grade 12. And I was like, this is what I want to do. I want to be her. And so I went into nursing school with this very Western medicine model sort of mindset. I was going to be an ER nurse. That's what was going to happen in my life. And I I'm so glad I went into nursing. It's so diversified. Like, look, listen to Kirk's career. It's so inspiring, right? And but when I went into nursing school, stigma infected me right then and there. I held stigma about cannabis. I thought it was just for lazy stoners. I held that stigma. And when I was in my third year of university and starting to work in the hospitals doing 12-hour shifts, a combination of high stress, life situations, and genetics led me to a place of high anxiety and insomnia. I started to experience at the age of, yeah, it would have been 21. I wouldn't sleep for days. I would
Wow.
look out my apartment window and be like, why is everybody sleeping except me? And then I would make my way to the hospital in the morning. And throughout my 12-hour shift, I'd grab little cat naps around the hospital. And then the cycle would repeat. I'd be up all night again. And it became debilitating. And so,
Yeah.
because I held that stigma about cannabis, cannabis was never a consideration at that time. And so I was totally inundated into that Western medicine model. Something's wrong with me. I go ask a doctor. I got to go talk to a doctor about what's wrong with me. And at the age of 21, I was prescribed sleeping medications as well as anxiety medications. 21 years old, binge drinking in nursing school, is getting medication that could have killed me. And so I started taking sleeping pills, and they were my sweet relief. And I'm like doing like seeing a psychologist at the same time, trying to wonder out what the fuck is wrong with me? Why can't I sleep? And but the sleeping pills, they worked. So I started consuming sleeping pills at the age of 21, and that became my crutch for 6 years. As a registered nurse who knew that medication was addictive, should not be used on a regular basis, consistently used sleeping pills for 6 years of my life, from the age of 21 to the age of 27. That was my prime drinking years too. And now I look back, and the mother in me just wants to hug that 21-year-old girl and say life's going to get better. And it's but I didn't know what else to do. And I asked the doctor what's wrong with me, and they prescribed, and those pills were prescribed to me consecutively every single time with a doctor without ever once being questioned, even though I held tons of shame within myself that I had to use them. And then
Yeah.
it was, I always say this universal moment comes in, because believe me, I woke up every day feeling like a bag of garbage. It would take me till about 10 o'clock on my shift to feel alert, to get that metallic taste out of my mouth and no longer feel like I'm dragging my ass through the department. And the universe came in and was like, things need to change. And I unexpectedly became pregnant. And I thought, this is perfect. I'm going to flush these pills down the toilet. This baby's going to make me so sick and tired that I'm going to sleep. I didn't sleep. Big surprise. I didn't sleep. And it was about 4 weeks of no sleep. I continued to work because, I'm working in the ER department at the time. You show up for your colleagues no matter what. And I miscarried my first pregnancy. And so I sit there filled with shame that I'm addicted to sleeping pills, I can't sleep, and now I've lost a baby. That's when medical cannabis walked into my life. Was at my lowest, rock bottom place in my life. Western medicine had failed me. I had failed myself. And here I am, a registered nurse that can't sleep or hold a pregnancy. And that's when medical cannabis was a little bit easier to access at that time. We started to have pop-up clinics. And so, filled with fear and stigma, I drove 4 hours to get my medical cannabis license to try medical cannabis because I had nothing else. I hadn't slept. I'm grieving. And when I sat in that waiting room full of my own personal stigmas, I was sweating. My heart was beating. And I looked around this room. It was packed. There was such a variety of people there. And I wondered why each one of these people was there. What was their story? Why are they here? Have they suffered as much as I have right now? So I had a 5-minute appointment with the doctor. I'm filled with fear, grief, everything bad. 5-minute appointment with the doctor, was shoved over to an educator. He was 19 years old and stoned, sitting in front of me, teaching me about his favorite plant, dope. And here I am, somebody who's never barely consumed cannabis. Like, I touched it maybe twice in university when I was like drunk as a skunk, like, and here I am at my most vulnerable, sitting in front of a 19-year-old kid who has no idea about medicine, has no idea about human connection, and he's telling me about dope. Luckily, I had people in my life that knew more about cannabis than I did, and I started to consume cannabis, and my world started to change. I remember looking forward to that every night. The only thing that was available at that time was flower, so I'd inhale cannabis, and I would sleep. I'd feel my body relax, my mind slow down. I would sleep, and I would get up refreshed. And my partner at the time said to me, "You're back." And I'm like, "What do you mean?" He had known me my whole life. And he said, "You're back." And I was, "What?" He said, "You're bright again." And then I sat there and realized I had lost 6 years of being who I was because of a pharmaceutical medication and because of stigma. And so, sorry, this gets on to a long story. um,
It's a beautiful long story, though. It's the crux of this whole thing. So please continue.
it's just like so many examples of like my own personal stigma as a healthcare provider, stigma from the system. And from then and there, I like started to open up my world to cannabis. And the first place I started was educating myself about the history and stigma of cannabis. I started to examine my own stigma about cannabis. Why did I feel so uncomfortable accessing something that was now medically legal to me? But yet I felt it was easy to access a pharmaceutical that was taking away my personality. And so I started to learn, and I started to realize that everything I'd been taught was so wrong, that this was an incredibly ancient medicine. I had a body system for it. And it just ignited this huge fire in me. And it's the reason why I'm here today. My darkest moment in life has led it to the brightest moment in my life now. And so from that, the journey continues. I start educating. I have a healthy pregnancy. I have my first baby. And it was in my second maternity leave that I got the opportunity to start to write the first accredited holistic cannabis nursing program in Canada. And I'm excited to sit here today and say next month we start conversations, or I've already started them, but it's going to be accredited by the Canadian Nursing Association, which I'm really, really excited. I know, Kirk, I forgot to tell you beforehand. We'll have to talk about that on your podcast. But that
and sorry, I just want to pause for a second. As somebody
Yeah.
who's not a nurse and doesn't really know that world, how is this accreditation different from the previous accreditation that you had?
So the previous accreditation comes through an American credentialing society for nurses, and it gives us a worldwide accreditation, but this is specific to Canada. The Canadian Nursing Association is going to recognize this for continuing education hours for nurses, which, as we start to talk about stigma and how we can influence change, it comes down to frickin' education. It's such a big piece of it is education.
And so
And in
having the official kind of regulating body for nurses, I'm going to call it that. I don't know if that's correct or not, but
It's not the regulating body. We each have provincial regulators, but it's a well-regarded. They have lots of specialty nursing programs that are accredited by them, and we'll be adding cannabis nursing into that. And they agree it's a
so
huge
it's a
gap. We
big
need
it's a
something.
big deal for a Canadian organization like that to
Yeah.
recognize this.
I can't believe it. I was a small town kid leaving this like farming community of 500 people that used to drive old trucks with holes in the floor. That never consumed dope is now written a program that the Canadian Nursing Association is going to accredit. But after that program came out at the same time, I had the opportunity to start the Cannabis Nurses & Co., which is an agency of nurses that provide holistic cannabis nursing support across Canada. And we receive referrals from Veterans Affairs Canada. And so we support our veterans in learning about their endocannabinoid system and how to maximize their use of their covered cannabis. And so in this lifetime, somehow I've had this beautiful opportunity and blessing to take my darkest moment and journey alongside individuals that were in a similar space. Because as I sat across from that kid, I was like, something has to change. As somebody in their deepest, most vulnerable moment when Western medicine has failed them, they deserve to be held and they deserve to receive proper care. And so that's why we sit here and we advocate that nurses become those educators in this space, that nurses are involved. You don't get a diabetic medication and told, head to this online platform, shop for whatever the heck you want, give it all a try and see how it goes.
Yeah.
Nobody's told that.
Yeah.
But they do that with cannabis. So we're sort of on this mission to bring those knowledgeable educators into this space, and within that be able to show really incredible positive outcomes, because I'm a nurse who loves their job. I get to say that in 2025. Kirk, how many people do you think get to say that?
No, right now nursing profession is in jeopardy right now. There's a lot of tired, abused nurses. Kayla, there's so much stuff to unpack in what you just said, you know.
I just started going. Sorry.
Yeah, no, that's no. And as two nurses, you're right. I need to talk to you for my podcast. So I'm sorry, technology. My phone decided to.
Yes, let's go back to you, Kirk.
Yeah, well, no, it paired up with my computer, so I had to turn off my phone. So no, So my podcast, I got into cannabis as a professional nurse in using a podcast. And my collaborative partner is a pharmacist, and he literally tapped on my dining room window and said, Trudeau's going to make cannabis legal. I said, cannabis is already legal. No, he's going to make it recreational legal. I said, yeah, but it's been medicine since 2001. Long story short, Trevor and I started the podcast because we wanted to get into it. He came to me because I guess, with a relationship with cannabis since I was a teenager, I'm known as a guy that likes his cannabis. So as a nurse, it was very difficult to bring cannabis into the workplace. When I was managing the local hospital, as a manager of the hospital, I was trying to bring cannabis into the hospital. And that was back in the aughts. No one took me seriously. And I said, cannabis is recognized as a medicine, by the federal government. And this is where the disconnect, and we're talking about stigma. I believe, it's my theory, that the disconnect happened when the Supreme Court told the federal government that cannabis is medicine. So the federal government was told by the Supreme Court, you must do something. So they assigned Health Canada to say, okay, cannabis is medicine. So we're going to have a federal program. You have to appreciate that the provinces are responsible for managing healthcare, right? And nursing, most people see nurses as subordinates to doctors that work in hospitals, whereas nurses actually have their own profession. So we have a regulatory college, like the College of Physicians and Surgeons, where there are colleges of nurses across the country. They're the ones that give us our license and our scope of practice. It's the employer who delegates what you can do in your scope of practice. So as a nurse, I can work up north for the federal government as an employer and provide primary care services for a community of 3,000 people in a remote fly-in community in the middle of nowhere. But a nurse in a small rural community working for the province can't do that. And if a doctor goes on vacation, that rural community doesn't have primary care because the doctor left town. Well, nurses have the scope of practice to provide those services for communities. We've been doing it for decades. We've been doing it since 1920. But doctors are seen as the primary care providers. So everyone's so worried about recruiting doctors. Meanwhile, they're treating nurses as employees like curtains, right? You guys probably don't remember the 1990s when the austerity happened right across the Western world, where they got rid of nurses and housekeepers from hospital facilities, right? Now, what keeps people well? Nurses. What keeps a building well? Housekeepers. The disconnect between doctors and nurses, and this is I'm going to get there, but nurses practice wellness, right? Nurses practice wellness. That's our job. We provide people wellness. Doctors work on a sickness model. You go see a doctor, he practices medicine. So, Kyla, sorry.
Kayla.
Okay, some people do it with a silent A. Okay, Kayla, sorry. So doctors practice medicine. So going to see your doctor because you're not sleeping, well, it's going to give you medicine. You go see a nurse and they're going to talk to you about your eating habits, when you go to bed, are you reading, are you using blue screens? It's so much a different model, right? So my nursing background going into cannabis, I did my due diligence. I called my college and told them what I wanted to do. I called my nursing protection that provides my insurance, told them what I was doing. And I still remember this. They gave me 5 things that I had to do if I was going to be a nursing podcaster. And I sat there and I waited a week and a half for a lawyer to phone me back. And they gave me a list of 5 things. I said, yeah, done that. Yeah, done that. Yeah, done that. Yeah, done that. And the last one is that they wanted me to go to journalism school. And they wanted to, because I was going to be podcasting as a journalist. I said, well, my wife is a educated journalist with a diploma on the wall, and I can just nudge her and say, and we also have a radio producer who's producing our audio podcast. So I've got 2 journalists that are involved with our podcast. And the lawyer pretty much said, well, why did you call me? Right. So there was a lot of ignorance in regards. I was told not to do it. Don't get into podcasting. But as a nurse, it's within my scope of practice to talk to people about medicine. So in my podcast, our podcast, I try to apply the nursing model to using cannabis. So every time I talk to an expert, and we've got 145 episodes up, we have talked to so many people in all aspects of cannabis, and I try to bring nursing into it. And I got a blog. So a lot of the things I read in your white paper, Sammy, we've talked about on our podcast. And so I became a cannabis nurse by de facto. The pandemic happened. I was up north. I was being abused as an employee. I went and did my due diligence. I did the pandemic. I was up north months at a time in communities. It was really hard work. Finally, I got to an age where I was allowed to retire. I quit my job, man. I basically quit my job. They called it retirement. So now I am a retired nurse. I think I'm retreading. I'm a retreaded nurse. I focus on cannabis. I'm also very much involved with like I said earlier, involved with the Canadian Association of Self-Employed Regulated Nurses. So I look at nursing and cannabis. So that's my background. And talking about stigma of cannabis, I don't know if your podcast is long enough.
No, I do not expect that we will have the time to go as deep as this topic warrants, even limiting it just like the healthcare space.
I think I
There's one
might
thing.
have a oh, go ahead, Sammy.
No,
Sorry.
no, no, no. I want to hear
I
your thoughts
just
there.
Um, maybe this will like help us like frame the conversation a little bit, but when the CNA, so the Canadian Nursing Association, they were through the what's it called, the Substance Use and Addictions Program, given $1.3 million at the time of recreational legalization to create a national nursing framework. And it was there meant to have e-learning modules and to help support clinical practice. Stigma already exists right in here because guess what? Those modules are no longer available. And they named it the non-medical cannabis framework. And so they're supposed to be guiding our clinical practice with a non-medical model, which then excludes a huge group of cannabis consumers.
I was on that committee, by the way. I was on that committee, and it was a big part of the conversation. Sorry to interrupt. Yeah.
But here they bring in a quote about stigma, and I think like it just hits home the impact on the medical cannabis consuming client is that stigma is a well-documented barrier to health-seeking behavior, engagement in care, and adherence to treatment across a range of health conditions. That sums it up right
Sorry,
there.
could you repeat that quote, Kayla?
Yeah. So the CNA, so the Canadian Nursing Association, stated stigma is a well-documented barrier to health-seeking behavior, engagement in care, and adherence to treatment across a range of health conditions. So we have barriers to care, engagement in care, and the adherence to care when we have stigma involved.
And is this a quote specifically about cannabis stigma? Okay.
Yep, this was right in the non-medical
This is
framework.
from their study because there's like a year or two that they were doing a whole bunch of studies around cannabis stigma, and this is.
Would you say it wasn't studies, right, Kirk? It was like they were trying to create a model to help nurses guide their clinical practice.
But
when it came to legalization.
Well, and that's the thing, right, that happened in healthcare. And I keep going back. Cannabis has been seen as medicine since 2001. But the colleges of nurses, the colleges of doctors, respiratory therapists, we ignored it. We just ignored it because there was this federal program and it had nothing to do with the provinces. All of a sudden, Trudeau said that he was going to make cannabis legal. And everything blew up, and cannabis became this new substance of misuse. So everybody went out and started getting money to study cannabis as a substance of misuse, to the point that those individuals and scholars that were studying cannabis as medicine before 2017, 2018, they were getting financed for it. But as soon as 2018 showed up, all the money went to cannabis as a misuse substance. So as a nurse, all of a sudden I started getting emails pushed to me about cannabis as a misuse substance. When my experience with this committee that just mentioned, Kayla just mentioned, was that we kept saying, but cannabis is a medicine to some people. No, but the premise of this committee is to look
misuse.
at non-medical use. So non-medical use of anything is seen as misuse, right? And again, I'm sure you know the studies as well as I do. When you compare cannabis to other misuse substances, it's benign. And I don't want to say benign, but there's always issues.
Yeah.
I mean, Trevor always gives me hell for this because I'm always telling people to just relax. It's just a plant. And yes, there are issues that you have to be aware of, but comparing it to alcohol is insane, right? Because cannabis is not alcohol. When Mothers Against Drunk Driving started spouting off about cannabis, I kept trying to say to him, cannabis is not alcohol. All the things we've learned about smoking and all the things we've learned about alcohol, we're going to apply to cannabis. But it's not alcohol. It doesn't react to the body the same way. First of all, there's no, I can go on to this, like cannabis overdosing, right? Cannabis poisoning. All of a sudden, there was a whole bunch of studies about increased use of the emergency departments. If you go into these papers and read it, the numbers are not significant. Yes.
Yeah, it's increased from like 3 to 100 across the entire country over the
Over
course of
5
the year.
years.
Yeah.
Over 5 years.
As opposed to hundreds of thousands, if not millions,
And
per year with the alcohol side
like
of things.
I love
Tylenol.
that you brought that in. I love that Tylenol probably does more harm actually, Kirk, than
Tylenol is the
cannabis.
number one liver killer in Canada.
Yeah.
I would
More than
So
alcohol.
yeah. Oh yeah.
yeah.
Yeah, it
Oh.
kills the liver
And
more
so
than alcohol does.
and
And
I
go
Go
ahead.
ahead.
I know we got so
You're
much to
so
say.
excitable. I was working in the emergency room at 2018 at the time of legalization. So there was conversations amongst the practitioners there, and they're like, "Oh my God, here we go. We're gonna see so much cannabinoid hyperemesis. Oh, here we go." And I'm here on a Sunday morning shift, going 3/4 of my department is filled with people with alcoholism or other use, but mostly alcohol. And every once in a while, we would get that cannabis use disorder individual in, or that cannabinoid hyperemesis. And it was like everybody just put their focus on it. And I would be like, okay, let's just like turn your head from this one patient that we see in like
to
6
the
months
15 others.
and just wait. These ones are all yelling and screaming at me and beating me up. And, like we can't control their withdrawal. Have we become like completely just, we don't even notice that anymore. But yet we're going to put this focus on this one young individual that is likely overusing cannabis. Yes. And now they're vomiting and they have extreme abdominal pain that we can't manage. But again, we like look back in other things that I've read that healthcare stigma, that poor individual is likely not going to get the care he deserves because he's a cannabis user. What if he actually has a gallbladder attack and we don't even look at the gallbladder because, oh, he told me he smoked pot? And then we get this like lens of focus, and here we go. We might be missing a huge diagnosis for this individual and giving them the wrong diagnoses.
And that's huge. And I've done rants about this myself, and I've written blog pieces about this, trying to compare cannabis and cannabis liver. I mean, you can go buy a bottle of Tylenol, and if you consume that bottle of Tylenol, you will be dead in 3 days, and it will be a horrible, horrible death. When
Those
I
are
was
some of the most dangerous clients we've seen put
yeah,
into the NAC protocols.
Tylenol overdoses are horrible. If you don't
Yeah.
get the antidote within 4 to 8 hours, you will be dead in 3 days, and there's nothing we can do about it, and you will die a horrible death. And you can buy that drug over the counter at any drugstore. It's a
Yeah.
bottle of death, and it's the number one killer of your liver in Canada. Nobody talks about it.
But where's the stigma when you talk to your doctor and you say, I'm overusing extra strength Tylenol and Advil to control my pain and I want to try
Yeah,
cannabis? And they're like,
yeah.
let's talk opioids and,
Oh yeah.
nerve blockers.
Well, it's
What?
still the third. It's still the third. Is it third or fourth level of pain management? When a doctor, medicine works with algorithms now, right? Medical legal issues, everyone's got algorithms. So if someone comes in with pain, a physician, or a better way, a prescriber goes through an algorithm. So first line is Tylenol, ibuprofen. Ibuprofen is not designed to be used more than 2 weeks. Not only will it give you stomach ulcers, it'll kill your kidney, especially if you're a diabetic. If you're using ibuprofen as a diabetic, you're mismanaging yourself. But that's the first line, right? And then they go to opiates, right? And don't get me started on gabapentin. I mean, gabapentin was used off-label, as a seizure drug. That all of a sudden, one person may have got some relief from their fibromyalgia, and now gabapentins, gabbies are everywhere. I used to work for the Manitoba Corrections, so I worked in our jails as well. Like I said, my career is very diverse, and gabbies were number one abuse in jails, sniffing gabbies, and again, so that was third line or fourth line, and then cannabis can maybe be considered as a fourth, and it's like, guys, cannabis, there's no lethal
It has
dose, right?
I have a living example about that, like that titration kind of schedule, and like how stigma throws cannabis at that bottom level. Even though it's not going to harm the liver, it's not going to harm the individual like all of those other prescribed medications. I had an elderly client that I was working with that had been on opioids. You know, he did the Tylenol, Advil, and then went over to opioids and was on them for years and years. And his kidney and liver was shutting down. So they're like, we got to get you off this. Oh, you have this cannabis prescription? Let's focus on that now. I successfully helped that individual get off of all of his opioids. You know, pain control was, you know, he still had pain, but it was comparable to the opioids, but his quality of life became better. I still lost him to his chronic kidney and liver failure.
because of the
But
opioids.
I was the last person to come in and educate and try to control his pain. And we did the best we could because of that plant. And he had the best possible life, but he still died
Yeah,
because of stigma. Because
yeah.
that, instead of it being one of the first line defenses, is one of the last. And I wonder if that, with cannabis sort of being that last line defense in medicine and sort of disregarded, is, you know, we know about this endocannabinoid system. We discovered it in the 80s and 90s, but even if we look at the discovery of the endocannabinoid system, the body system that cannabis works in, it was still sort of done through a stigmatized lens. We had the AIDS epidemic occurring, and these patients advocating, give me legal access, let me die with dignity. And then they go over in Jerusalem and they're like, nah, I don't care why THC is helping them. Let's just figure out why the hell you get stoned. And then they discover this like mass network of receptors and all these amazing functions of this endocannabinoid system. But when we present that to medicine, it's still like we're presenting it, we discovered it because of cannabis, which already holds stigma. So why that we don't see it in our curriculums?
No,
If
it's not.
doctors, if we
It's
seen
not.
it in our curriculums, maybe then we can start to piece together that actually it's very ethical and that we need to be having cannabis in there as a really viable thing for things like pain control, sleep, for goodness
Yeah.
sakes. Like it has, you know, it has so many things, but we still don't see it in curriculum because of stigma.
I've got a question for you guys. I wanna shift this conversation a little bit. I wanna kind of understand the more day-to-day lived experience.
Mm,
Stigma. So stigma. We've talked about kind of the effects of stigma a lot so far. What I'm curious about is how does it actually show up, like in the interactions? Like if you, Kayla, let's say, are working with a patient, you're like, I want this patient to use cannabis because that's gonna like address these issues with the least amount of side effects possible, and the most amount of like healing. This is just got that balance. And you were to suggest that, like, do people just look at you like you're crazy? Like, what is
mm,
the typical response from different types of people within the healthcare system? I'm really curious
yeah.
about that aspect of how stigma shows up.
I've seen it incredibly varied. And I've actually like seen like these subtle tiny shifts over time, which has been kind of great to see. But like we've worked with a young woman who's has breast cancer. She's young, she's raising a family and she's anxious and she's worried and she's having side effects and she wants to use cannabis. And so we write a letter for her. She takes it to her oncologist and he said he would not provide her with care if she used cannabis. Here's the individual saying, this is what I want to try. This is what aligns with my values. This is how I want to treat the cancer, not treat, but like help manage the cancer in my body. And the physician says, I will not treat you. And
Yeah,
yet we have a lot of clinical research in and around the use of cannabis with oncology.
yeah,
So that's a really terrible sign of stigma and lack
yeah.
of education from that physician. Um, where I've seen some shifts, which has been quite beautiful, is when we work with these clients, they tell us, I don't really talk to my doctor that much. I don't know how to talk to them about it. Or maybe they're just like inhaling cannabis at that time. Work with them, we provide them with the education, we start to use oral dosing, we start to, really kind of bring this education in around the medicinal value of this plant. And they said, I went and sat with my doctor and I knew what to say to them now. I felt educated and empowered, and I talked to that physician And now we're reducing my opioids, my sleeping pills, and they're actually in full support because they were empowered to have that conversation. And so it's
So
varies.
is that a big part of what you guys do with Cannabis Nurses and Co? Is it like all about you are a patient who really wants where this is a truly beneficial thing for your medical healing journey? Let's help you be educated so that you can have these conversations with the people who can actually prescribe medicine to you. Is that kind of an aspect of what
That's
you do?
it's a huge piece of it. Or we teach them how to access it if their doctors don't want them to. We teach
Yeah.
them the other ways to access medicine. But yeah, it's all about education and empowerment. There is nothing illegal about a nurse providing education. So when I
Yeah.
talk to the colleges and all that kind of stuff, well, what are you doing? Educating. Well, there's nothing illegal about that,
Yeah.
right? So it's like finding those loopholes to be able to do the work that we do. And I think when we look at stigma, one of the biggest ways that we defy stigma is through education. That's how I got over my
Yeah.
own stigma. It's just how do we get these
Yeah, because
people
the stigma is coming from ignorance.
yeah,
Ignorance that in this case is coming from a very, very awful, evil place of capitalism, and we don't want
greed?
this hemp plant to usurp nylon and plastics and trees and the paper industry and all these things, and just a whole bunch of billionaires coming together to demonize a plant. That's like,
Yep,
it's really, really corrupt and evil to know that that's where
yep.
it came from. But that's a whole other rabbit hole we're not going to get into. But it's ignorance ultimately.
Mhm.
It's intentional, manufactured ignorance over generations that is now settled in deep, and education is the only way to undo ignorance.
And like,
Um,
because yeah, you're wanting solutions, right? And it's like I would love to be able to sit in front of Health Canada and present case studies and share stories and whatever, but we're not there yet. They're not going to accept me to come talk to them. So it's like starting at that individual patient level, that individual consumer level, and so that they can have empowered conversations. And over time in our practice, I've had psychologists start calling our office and say, "Okay, who are you and what are you doing?" I'm like, "What do you mean?" Because you're just never quite sure where that conversation is going to go.
yeah,
And they
where they're
say
coming from. Yeah,
because my patient's pain is controlled, they're sleeping better and their mood is better, we've made it so much further in their psychological treatments. And so that to me is a way that we start to change stigma is like at each individual. That's like what we've
yeah.
adapted in or adopted into our practice is this head down patient-centered approach and then allow those kind of ripples start to push out
And
and
you know
watch.
what? Like, there's people who try to change the world and they go right to the top and they're like, "Oh, Health Canada has to change. We're going to do this thing." That is a way to change the world if you are able to convince, big government organizations, big multinational companies, whatever it is, to change. But the world also changes from the ground up. Like, we are a collection of interactions, of moments, of lived experiences, and if you
Like
impact
so
a
true.
life, that impacts the lives around that, and the ripple effect is real. Like, I think the biggest revolutionary changes all happen on that local individualized level, and it just spreads through that.
Well,
So
and like Kirk's podcast was like when I started to fall in love with cannabis, I was like, I'm the only nurse out in the wild here that's in love with cannabis or felt like I was. And then I found his podcast. And I
yeah,
was like, yes, there's somebody else advocating. He's bringing on experts. Like has this extensive nursing career and is able to talk about cannabis and advocate for cannabis. And
yeah,
so there's another little ripple. So it's so full circle to sit with you, Kirk, because since I
Well,
was young and
it
not sure what I was going to do with all of this, your
it is
podcast
funny.
is a huge inspiration for me.
Well,
So
thank you for that. I was thinking about stigma, and I ran into it big time a couple months back. We've done extensive interviews of experts. We interviewed a doctor that did a study in long-term care using cannabis with dementia in
yes,
long-term care.
love that work.
Amazing study. He found, first of all, one thing you have to understand when somebody, more and more of us are going to have dementia. We're living, my generation's living longer. Your generation may not live as long as my generation. That's a different demographic thing.
Yeah,
Well, I
I've
know
been worried.
for the first time ever, there's a threat that the younger generation may not live as long, but that's a different thing. But
Unless you're using cannabis.
correct, correct. Longevity. But there was a doctor is doing studies with dementia, right? And one of the things with people who have dementia, there's something called sundowning. And people in dementia can get very violent, very aggressive, and can be dangerous, right? So medicine, doctors practice medicine. So what they do is they provide these medicines that are very strong, sedatives or antipsychotics to control the behavior of someone that has dementia. One thing that happens as you start getting into these strong drugs, you lower the lifespan of this individual. So if somebody has youthful dementia, you lower. Now, that's an ethical discussion for, again, another podcast. But this guy is introduced to cannabis. And what they're finding is cannabis is low risk, because one thing we haven't discussed here is that opioids can attack your brain stem. And if you take enough opioids or alcohol, you will just stop breathing, right? You'll just stop and you'll die. Whereas cannabis doesn't do that. There is no ability for cannabis to kill you. It just won't. That's why I don't like the terminology cannabis poisoning or cannabis overdose. What it is that you overindulged in THC. So it's the cannabinoid THC that's causing the problem, not CBD, not CBG, not so
Yeah.
I'm trying to change the terminology that it's not cannabis poisoning, it's
Yeah.
THC overindulgence, right?
And
So
that, by the way, sorry, just to
Words.
pause, that was one of the biggest things that I had to learn in my life, because I used to use cannabis quite a bit, and it would make me. There was a point in my life where some things shifted and became very bad for me,
oh
Yeah.
and it took I took years to actually stop using cannabis, to quit
well,
and
I don't
stop
recommend a
addiction.
green out. I don't recommend it. Like I said, I've had an experience with cannabis for a long time, and I had my first green out experience about 6 months ago. I made a batch of cookies, and I have a medicinal license, and I made a batch of cookie, and I took a cookie and I started cleaning my house and started preparing stuff, and I realized, oh, this
Yeah.
isn't going to be good. And I had my first green out. It's not pleasant. It's an awful, awful experience. But I knew I wasn't going to die. So I wrestled myself out of it, right? But I can understand why people who get it don't know when they run to the emergency department. Don't run to the emergency department.
And then
I
that's just
wrote
like perpetuating stigma, because then we're
very
just
much
like,
so.
they're for cannabis poisoning, but
Yeah.
cannabis has so much more than just THC.
Yeah,
And
exactly.
like stigma, like that's why all we see in our rec stores is
Yeah.
like that our provincial regulators are only picking up high THC products.
And the new one, and in Rick stores right now, the infused pre-rolled joint
Oh,
is the big thing. Like what? I'm
I
sorry,
hate
but
it.
as a rec user, why do you want 60% THC? I don't get it. However, I'm going
Because
back
you've
to this.
abused THC.
Yes, you
And
have.
it's
You've
so,
abused THC, certainly. But going back to my long-term care experience, so I have this understanding of cannabis and long-term care. A few months back, I was working as a instructor for healthcare aid students, primary care workers that work in healthcare aids. I was their clinical instructor. I was on the floor. First time I've been on a floor in decades, helping these students learn basic bedside care. Well, there was an individual in this long-term care that was getting cannabis. So I started asking the nurses about the cannabis, right? How's it work? Blah blah blah. Well, the family was bringing the cannabis in from the rec store, and they were providing it because the nurses were giving it because the nurses are responsible, but the nurses didn't know anything about cannabis. So in the healthcare industry, usually what happens is the person with the highest level of expertise in a situation usually leads the team. So here I am, I don't have a role. My role is to be with these students, but I'm in an environment where somebody's using cannabis that has questions, and the people around her don't understand what they're giving, which is professional incompetence, but that's not my job, right? However,
oh,
they're
I
they're
know.
they're doling out this medicine that's recreationally bought with no understanding. So I tried to help the patient. Well, the patient was very, I was enthusiastic. She was enthusiastic. She started telling nurses. Well, the nurses got inconvenienced by me and made a complaint to the college, the education college, not the nursing college. So the people that hired me said, "What were you doing?" I said, "I was practicing nursing." Well, that wasn't your role. Correct. It wasn't my role, but a nurse is a nurse is a nurse, and the person had information, so I provided it. But the stigma got me in trouble. I know about cannabis. I was in a role to provide someone education, but I got in trouble for doing it, which was stigma based. It was all stigma based, right? I tried to go to the doctor, who was a South African doc. He basically was very honest with me that his understanding of cannabis is that it's a substance of misuse. So he didn't see it as medicine. He did promise to listen to my podcast, but I don't know if he ever did. So I don't know. But there's so much stigma, to the point, cannabis coaches, you talk about that stone 19-year-olds, right? What's happening now, because healthcare is, I shouldn't say completely, we are ignoring cannabis as medicine, right?
That's the thing. It's like head in the sand kind of approach, but yet we don't fill our scope of practice because we don't have knowledge. Because every nurse, no matter where they work, will interact with clients that are curious about cannabis, consuming cannabis, or have consumed cannabis. But yet
Yeah.
we are not able to provide them with patient-centered care because we don't have the education.
Well,
Or like
yes
the
and no.
random group of us that do.
Well, yes and no, but remember, a lot of nurses, not all nurses are equal, right? There's LPNs, there's RNs, there's BSNs, there's a lot of different type of nurses, but a lot of nurses work as employees. And this goes back to my hat where as an independent practitioner, they work as an employee, so they follow guidelines. And the guideline is in the hospital policy is cannabis is a substance of misuse, not a medicine. So they don't go out of the way. So there's this void of information. So the industry has created cannabis coaches. And we've interviewed these individuals. They're going out and they're trying to create standards of practice for cannabis coaches. So what we have now is we have a brand new non-regulated health provider called the Cannabis Coach, which we need. However, why aren't we doing it as nurses, right? Where's the nursing profession? Why aren't we educating ourselves? And congratulations on creating that educational program. That's a wonderful little flower. That's
I call it
fantastic.
my third child. It took so
Good
long
for
to
you.
create. Thank you.
Good for you. That's and so now the goal is to get out there and educate people on it and nurses about it and remind nurses that nurses aren't seen in the provincial systems. Nurses are not seen as assets. Nurses are expenditures, right? So health systems don't realize that a lot of nurses are leaving, not because we're tired of being abused as nurses. I left the system because nurses, we didn't have a say. Nurses don't sit on the proper committees. Nurses don't sit on boards. Like it's all doctors and it's like, where are the nurses in healthcare? And I'm trying to promote that with the Canadian Association of Self-Employed Nurses, is that we are so much more than employees of provincial health systems, right?
Well,
We
and
have
like,
this,
where are nurses in the medical cannabis world? Where are nurse
yeah,
educators? But like Sammy, like it brings it back to your white paper where it's so entrenched in stigma because no producer, no medical cannabis clinic is viable enough to be able to afford and pay for a nurse.
yeah.
Like to pay
Well,
what they're worth to be in that profession, to have that part of this world. So it's like, yeah, the layers of stigma are so deep. There's health professionals without education. There's a system that doesn't allow it to be viable. And stigma is like, it's everywhere. Patients can't even barely afford the cannabis that they could use to gain a really powerful quality of life, but yet they can get all their opioids and sleeping pills and everything covered.
yeah,
But yet they can't get medical cannabis covered and they're taxed on it.
yeah.
Again, stigma. It's because
And
we
now
don't
the
believe it's
government
a viable medicine.
And now the government is suggesting that people can get their medical cannabis from rec
Yeah,
stores. And doctors are actually, and I've
bad.
seen this, oh, I'm completely against that. And doctors now are actually telling people, if you want your medical cannabis, just go to get your. So what's happened now is people are using cannabis and it's non-documented medicine. So the doctors, so pharmacists aren't doing medical audits with knowing the cannabis is part of their routine.
We see it
We
in the
did a
statistical trends, Kirk.
and it
So like,
and it's not even, I wouldn't even consider it medicine when it's like 25% plus THC and all the other cannabinoids are less than 1%.
well,
That's
no, but in some cases, I mean, and uh, the Victoria Buyers Club, Canada's Buy, they've talked about it. There is some need for high THC for some medical patients. Some suppositories need to be high. But I mean, I
yes.
was in Haida Gwaii and visiting the First Nations dispensary. They had a pre-roll. No, a gummy. They had a gummy, 1,000 milligrams of THC in a gummy. Like, okay, recreationally, that's crazy. Medicine, possibly some patients might benefit from that, but that's an awful lot of THC, man. Like
It's
that's a
detrimental to the endocannabinoid system, and like where doctors are like routing patients now that we have these rec stores everywhere. I feel like
yeah,
it gives doctors just an excuse to be like,
yeah,
"Oh, I don't know about that. Just go to your pot shop." And
yeah.
then we have this like super vulnerable individual walking into a shop. I had a client who hadn't slept in 30 days with PTSD walk into a pot shop and be handed a 50% pre-rolled THC joint who had never consumed cannabis before.
Wow, that
He's lucky
that's
he probably had no receptors in his brain for it because he was fine. But
yeah,
that's dangerous. And like
yeah,
statistically we've seen that too. Like when they did the Cannabis Act review. So in 2018, so at the time of legalization, we had 317,000 medical registered patients with the medical program in Canada. Now, by 2023, we had 203,000. So here we have like 115K Canadians shopping for their medicine in recreational stores where you're not allowed to give advice. And in the paper, you talk about it, Sammy. Like, what are we doing about this? Bud tenders, do they need education? Like, how are we catching these vulnerable individuals that are walking into a shop? And a doctor would rather be like, just send them there, just brush it, I don't want to deal with this. And that's stigma.
But you know
So
what's happening? The industry is covering that. I just interviewed a group out of Ontario. Two pharmacists has opened up a virtual pharmacy, and they are
I've heard
going
that.
into rec stores, and they're saying, "Here's our card. Have people call us." So people are seeing this as an opportunity for business now. If you're going into the rec store to get your medicine, you can call these pharmacists, and they will charge you for this. But they are now pharmaceutical cannabis coaches, right? So yeah, it's so the marketplace is seeing the void and providing the assistance, and pharmacists are doing it. I don't see. I mean, you've done it. A lot of nurses are ignoring it. Yeah, it's it's
We got
fascinating.
work to do.
Oh yeah, we do. Oh, we do.
so this is a huge systemic thing, and it runs really, really deep. And I appreciate all the work that you're doing on the education front, Kayla, through the program that you've created and through the cannabis nurses, and Kirk as well. Appreciate the education you're doing through your podcast. Like those things helps, I'm sure. Like even if like just one person is influenced by it, that's a win. And I know that hundreds, if not thousands, of people are being influenced directly by what you guys do, let alone the indirect ripple effects and butterfly effect, so to speak, of the work you're doing. Um, do you guys have any ideas on how to like go beyond that? Like, Kirk,
Mm.
one thing you said a few times is that I'm actually curious to chat about as well, but we'll see how it makes sense flow wise. You talked about how, one of the issues is that the federal government said, hey, cannabis is now medicine. And then the provincial governments that actually like provide the whole framework around healthcare are like, no. I agree with you to a certain degree. Where I disagree is that it's the courts telling Health Canada, the federal
Yeah.
agency, cannabis is medicine, and Health Canada, the federal government, also saying we disagree. We're going to do it anyway because we're being forced to by the courts, but we do not think this is medicine. Like that. That's I think like it's that too. In addition to what you're talking about with the provincial side of things.
And
So
that's
when you
mirrored like in Veterans Affairs too, Sammy, because veterans they have covered access to cannabis because of the courts. And
yeah.
now we have all these medical officers sitting within Veterans Affairs despite spending like over $300 million a year on Canadian taxpayers' dollars on cannabis that for our veterans that don't believe it's medicine.
Yeah.
You know what
So
kills me? What kills me about this is that government is made up of people, right? And statistically speaking, surveys say that most people in Canada understand cannabis. Now, what is it? The last study? What 27% of Canadians apparently have tried cannabis. I think the number's higher, but whatever, But people are starting to understand cannabis. But people make up government, and it's the bureaucrats that make the laws and the politicians that come up with the idea. The problem is that there's a disconnect between the politicians, the bureaucrats, and the public. Like we've got a solid conservative group of people that still think cannabis a
Devil's lettuce.
devil's weed, right? But that's few and far between, because right now the statistics suggest that the elderly people my age they're going out and exploring cannabis as medicine at rec shops.
Yeah.
So government eventually has to respond to the employees and not the politics, right?
So how do we get there? That's kind of my question.
Good
What are the
question.
thoughts? What are the thoughts that you
Research,
guys have?
research.
But
But
how do we do? Because you were talking earlier, I think Kirk, you were talking about this. How the research shifted with
Yep,
legalization from medicine focus to substance abuse focus.
yeah.
that's a good point.
How do we? So research, education. I understand those things. How do we have a bigger impact? Because
Well, Trevor, my buddy Trevor, the pharmacist, he will tell you that big pharma has to get involved. Now, the green
Mm.
culture doesn't want pharma anywhere near cannabis. But if you think about it, it takes 20 years to get a medicine on the market. It costs billions of dollars to get medicine on the market because they make money off of it. But the problem with cannabis is it doesn't have a drug
Din.
identification number, right? It doesn't have a DIN number. And a DIN number means that Health Canada has identified that this substance is seen as a medicine because it is used for X condition. This is the route that it's used for, and this is the demographic. So Health Canada does that. The
are
problem is
question for you: are there any herbs that have DIN numbers today?
no, because the
It's
problem
not
with plant,
nutraceuticals.
yeah, the problem with getting a medical number, a drug number, is that plant medicine is multimolecular,
Mm.
right? THC, they have nabilone, which is a synthetic
Yeah.
cannabis that has a number because it's one molecular component.
So
So,
so it's
so
really a specific compound, a specific molecule that is being
correct. But
okay.
think about how complicated cannabis is. Not
Yeah,
only
where you
do
have
we have indica and and sativa, and not only do we have hemp and non-hemp, not only do we have one strain or another strain, we have 100 and what cannabinoids,
Yeah,
hundreds of terpenes,
hundreds of
yeah.
terpenes,
flavonoids.
cannabinoids.
Yeah.
So,
Flavonoids, yeah,
so we've
exactly.
interviewed people on our podcast who are actually taking those molecular substances of cannabis and putting it through the laboratory to create a recognized medicine. So one of the solutions may come through the pharmaceutical industry, but that's decades away and completely goes against the whole green culture because cannabis is the whole entourage effect or ensemble effect, depending on who you talk to, because we talked about THC overindulgence. It's awful,
Mm.
but you can't, and CBD can harm the liver, so you have to be careful on the balance, right? So, and if you inhale it, the hydrocarbons might be an issue, or if you take it under the tongue. So there are so many facets of this plant that it's very difficult for Health Canada. So to be fair to the bureaucrats, it's very difficult to categorize it as medicine. So,
Oh,
But
right.
but
And here too, there's
it's difficult to categorize it as medicine when your definition of medicine is a molecule.
stigmatized. Yeah, just one
correct,
molecule. Like when you take
correct.
aspirin out of white willow bark, it's one molecular structure. It eats your stomach lining. If you
Yeah.
consume white willow bark, it protects your stomach lining and is an anti-inflammatory. So I was just not looking at the screen here because when the Cannabis Act review came out in 2024, they're talking about this like research and they're putting their suggestions forward. You pulled it into your white paper. But we need to be able to it's very difficult for cannabis producers to be able to manufacture according to the good manufacturing practices, which is a requirement for research. So here's another barrier, even at if we do want to research the plant, the producer themselves has a huge barrier at not even be able
Yeah.
to produce the plant as per these practices to make it viable for research. So
Yeah.
here it's it goes even back to the growing part, not even that it is a molecular structure. So it's we need that policy reform and being able to make these producers meet these requirements so that we can start doing clinical research. And they're calling on clinical research. And again, like you said, it shifted into harm, but they're calling on clinical research, not only for these medical patients, but also to be able to guide our public health policy. And they recognize that in the 5 years and all this excise tax and where the hell did all this money go? these producers aren't getting it.
Yeah.
And this government is, but yet we're not funneling any of that money into research. Dr. Linda Belmuse, who you've introduced, like who's a researcher in the space out of Manitoba, who Kirk's interviewed, says that all the time. Like, we're not getting any of that funding coming into research. So
and I know that Sammy, you want us to talk about positive things and what are the answers. The answer is we need good research done by big pharma, and I know I'm going to get shot for that because
good
we
thing
don't.
you're nowhere, Kirk. Nobody can
know,
find you.
Exactly. I'm in the middle of the continent. You can't find me. But really, we need that help from big pharma. As much as it kills me to say so, we need to have courses available, which we now do, and we need to understand that people do use it as medicine. So if people are using it as medicine, why are we as health professionals not recognizing it? Now, I did a little bit of research as well preparing for this, and the College of Registered Nurses of Manitoba, the Psychiatric College of Psychiatric Nurses, the College of Licensed Practical Nurses. So my professional body as nursing, they've come out and said it's a responsibility of nurses to understand cannabis as medicine and as a substance of misuse. So as a professional body, my profession has said in Manitoba, you need to know this stuff. The problem is people see nurses as hospital employees, not as a standalone profession, right? Nurses are a standalone profession. We have our own scope of practice. We're not allowed to access our full scope of practice in the healthcare field. So even as a nurse that's knowledgeable about cannabis, I am restricted in what I can say to people within the provincial healthcare system, right? But because I'm a self-employed nurse, as you are, we can stand up and say, you guys, come on, cannabis is medicine and this is how we have to do it. So we need more self-employed nurses to get out there and flog cannabis. And I do mean flog it.
Just to interrupt and just kind of understand this better. So you're basically saying that the big issue for nurses generally is that their employers don't allow them to kind of
Correct.
Okay.
My
to practice
employer,
to our full scope of practice. Like
yeah,
when I built my own independent practice as a nurse, I had to pour through all those documents to make sure I was upholding my scope of practice because I'm a regulated health professional. And I was laughing reading at it because I was like, in a merge, I didn't meet my scope of practice working for the provincial health authority. Whereas now, as a holistic cannabis nurse, I fully meet that scope. And Kirk, I really liked when you said nurses teach about wellness.
yeah.
How can nurses teach about wellness without understanding the endocannabinoid system and the endocannabinoidome?
Well,
Because
exactly.
that is
Exactly. Well, you mentioned Linda Belneves. I mean, she's gone out. There is no the endocannabinoid system is not taught in nursing curriculum. It's not taught in medical curriculum. It's not taught. And what we've discovered, and again, I've said this 1,000 times, back in my youth, when I was probably your ages, I was a long distance runner. I ran. I don't know if you remember in Alberta, there was a race from Jasper to Banff. And we used to run that length of highway. I don't know if you know its elevation. I ran those, and I I don't want to say a competitive runner, but I ran a lot. And I was striving for a 3-hour marathon. So I was running hard and fast. And my goal was always to hit the wall. And you've heard that. Anybody that's ran, you run into the wall and you go, oh my God, the endorphin rush is astounding. I can remember saying, this is back in the 90s, and I was running up 6th grade highways at the Columbia ice fields. And when I finished my race, I had the best high. I felt like I had consumed cookies of cannabis. And I can remember telling my chiropractor, who was snapping me back together because I had another race to do, but how high I was, not knowing that it was my endocannabinoid system, not my endorphins. Right?
Your body's own made cannabis, your body's own made THC.
I was racing on endocannabinoids. And when I started learning about the endocannabinoid system, it was a big ha-ha. There you go.
They just had a study come out proving that, Kirk.
Yeah.
So the runner's high is a endocannabinoid?
It's endocannabinoid.
Interesting.
It's not endorphins. Yeah. So this is
Is it like an anandamide and what was
Yes,
the
yeah, yeah, yeah.
Sammy, it's just like the long hug we had to boost anandamide at that conference.
okay?
Remember, it's the same concept.
No, I
Yeah.
remember because we've had Kayla on the podcast before to talk about the endocannabinoid system, and I remember she was talking about anandamide and a different thing that also shows up in.
2AG, yeah.
So is it those same two things, or is there like a third thing that happens with like the runner's
Possibly.
high?
Maybe there's other things happening we don't know yet, but
We
it's
have
the
so much
endocannabinoids.
to learn.
Yeah.
And maybe that's piece of like defying stigma, changing stigma is actually teaching about the endocannabinoid system in medicine. And you
Yeah.
don't need to even teach about it through the lens of cannabis itself, but it's a master regulator of the human body.
Yeah.
That's like so important to human health and human wellness that what we really teach in our practice is yes, cannabis is a tool. I love cannabis. I have pot leaf on my neck, like on my arm, everywhere. I love it. But the more important thing is that I love the endocannabinoid system. And ultimately what we want to teach individuals is that we can use cannabis as a stepping stone. Let's get your pain under control. Let's help your sleep. Let's improve your mood so that you can live a healthy lifestyle that supports the endocannabinoid system. Therefore, you need the least amount of cannabis possible in your system, and you're going to have the least amount of reliance on our healthcare system. So we're teaching people to put health into their own hands. But again, we have cannabis stigma, plus we have this sort of like westernized medicine model of health in Canada and North America. And it's not working. We
Yeah.
know that it's
Well,
not working.
a friend of mine hurt her back, right? And she wanted to make an appointment to her doctor. And I said, "Why are you going to go see your doctor for your back pain?" Well, he's my doctor. I said, "Doctors aren't going to give you anything but medicine for your back pain. Go to your chiropractor, go to your massage therapist, go to your physiotherapist, go to somebody that actually focuses on locomotion. Your family doc is just going to give you a prescription for an opioid." You know, so and
Breathwork and meditation can reduce pain levels because it impacts the endocannabinoid system.
well,
So I think that's a huge part of stigma is defying stigma is actually getting it into curriculum, getting
correct.
the endocannabinoid system taught, and starting to shift our lens about how we view wellness.
Yes.
I have a question for you both. Do you think more than half of doctors in the world, or let's just focus on Canada, do you think more than half or less than half of doctors in Canada know that human breast milk has cannabinoids in it?
I would say less. I'd say
What would
10% no. No,
to
I'm
me
not
like
even
that's
that.
I don't think
Not even
doctors
that.
care. I don't think the doctors care, to be honest. I don't think they care.
But you know what? I've talked since our chat, Kayla. I've had this
Yeah.
conversation with a few people, and every single time, people's minds are blown. And if they were somebody who held stigma before, I can see that turning. So I feel like maybe we're talking about solutions. Maybe just like a campaign of did you know there's cannabinoids in breast milk, and every single person alive
I just
has
finished.
Yeah.
relied on it to
And if
develop
you
their
cut
brain.
them off, infant mice stop feeding.
Yeah. Well, it helps with latching. It helps with the latching, right? But I just interviewed a doctor in Florida, OBGYN, and she's a cannabis wellness doc, and she was explaining to me how basically the endocannabinoid system is ultimately responsible for the whole movement of the egg into the uterus and the whole binding. And it's like, wow, hold on. Wow. So if
Could
you
we
don't have,
address infertility if we looked at the endocannabinoid system?
yeah,
Could
yeah,
we
yeah,
address metabolic disorders if we looked at the endocannabinoid system? Cancers? So
yeah.
many things. So maybe
You
it's
guys,
not
Dopamine.
about studying
Nope.
cannabis.
No,
It's about
no.
studying the endocannabinoid system. And then we add
Correct.
cannabis in later.
you guys are
Correct.
making me want to have season 5 of the State of Craft just be about the endocannabinoid system and just be like
We
It's
should,
it's
and we
fascinating.
we've got
It's
the
fascinating.
like, and it's the endocannabinoid ohm. It's even bigger than just the endocannabinoid system, which then we start to look at things like nutraceuticals, lifestyle medicine, and psychedelics and how it impacts the greater environment. Dr. Cody Peterson has some amazing
Yeah.
chats about the endocannabinoid dome, and I just updated the program to add that understanding into it. And he talks so much about how the endocannabinoid system is stigmatized because it's viewed through the lens of THC, because that's how we discovered it.
Yeah.
Whereas when we look at it, that it's this endocannabinoid dome, he calls it ubiquitous. It's everywhere. It's everywhere. It's in animals. It's in every mammal. It's in humans. It's so diverse and so important to our understanding about medicine in the human body, and we're
How we
not talking about it.
well, how we understand medicine in general, Sammy. One of the cornerstones of being a Canadian is our healthcare, right? Everyone talks about we're Canadian because we have free healthcare. Well, I'm a proponent of free healthcare and universal healthcare, but people and they don't want private healthcare. But what you have to realize is that our family doctors have been private businessmen since the dawning of
Mm,
healthcare. Right? We've had private businessmen managing the healthcare system since the dawning of time. So as an employee of a provincial system, when I'm a nurse there, I'm working within the universal healthcare plan. The doctor's not. The doctor's a fee
So
for
so a
service.
doctor so a
yeah.
doctor at a hospital is not an employee of the hospital, or how?
No, they're
No.
fee for service. They're fee for
Yeah.
service.
Oh,
Right? They will have
interesting.
a contract. When I was managing, when I was managing in a hospital, one of the doctors had like over 200 charts that he hadn't signed. So I was a brand new manager, and the medical records person was very upset because the doctor's not signing off the chart. If he doesn't sign off the chart can't go
Can't
back
bill
into
for it.
place, and people can't get it. Well, he can't bill for it. I'm sure he's finding a way to bill for it, but the chart can't move off that shelf, and so other people can't find it. It just pollutes the system. I said naively, remove the doctor's privileges. And everyone, it stopped the conversation. It said, what are you talking about? It said, the doctor has a privilege to work in this hospital. He's not following the rule. Remove his privilege. Oh, you can't do that. Why not? Right? But that's a different system. That's a different car because easy. Remove his privileges and he's going to sign his charts. I was naive, apparently, so I didn't last long in a management position. However, but the universal healthcare, we need to open it up and look at it again without threat,
Yeah.
because the whole system is built on a sickness model.
Yeah.
It's more important for a small town to have a CAT scan than put money into our high school and teach kids how to eat and cook healthy foods.
Yeah.
It's easier for us. It's I can go on and on and
No,
on.
I totally agree with you. I think though that what you're arguing for here is a bigger hill to climb, because to move away from a sickness model to a wellness
Wellness
model
model.
means taking on the big pharma as a whole and threatening their trillion-dollar industry. And I think that's going to be that's going to be a
Well,
And
very
this
hard
and the
this
fight to
goes
whole
win.
on. Yeah,
educational system for health practitioners is based on a sickness model, not a
and you
wellness
Yeah,
can't
model.
measure.
because
That's
that's what makes big pharma money, and it's
Well, you
yeah.
all
can't measure.
money
Yeah,
influenced.
you can't measure, and you can't measure wellness, unfortunately, right? It takes a
Yeah,
generation to
Not
meet,
easily.
right? It
yeah,
takes a
Even in
generation.
research,
Yeah,
even
yeah.
in research, we can't measure wellness
no,
easily, or
it's
it's not
25 years.
as
It's not
well regarded.
quantifiable in the same exact way as, oh, you
25
have a
years.
spike of this particular
Yeah.
compound that's bad for you.
Yeah.
Clearly, we can measure that. Blah blah blah.
And
Sammy,
then that's
I was just
go
going
ahead,
to say,
Kirk.
Sammy, you mentioned the whole pharmaceutical component, right? Like we touched on it earlier, off using medications off label, right? There's a lot of medications that doctors are prepared to use off label. What that means is that Health Canada has said this medication is for this issue. But a doctor has, or I should say a prescriber, usually doctors, because they work independently. Nurse practitioners can only work as employees in this province. However, the doctor has the privilege to practice medicine and use any medication he wants for whatever he thinks his patient needs. That's his privilege, her privilege, their privilege, right? But what's interesting about that is that there are so many risks and benefits to do that. So when I ask the argument, so why don't we consider cannabis? The question always comes back, well, we don't have the research. And I say, so where's your research on using gabapentin for fibromyalgia? Where's your research? Big Pharma has said that they could use it. Big Pharma, I'm old enough to remember the 80s when Big Pharma told doctors that the new vital
Opioid.
sign was the pain scale. And I can remember being in a conference where we had to do the pain scale with our blood pressure. What's your pain now? Oh, it's an 8. What's your pain an hour from now? Oh, it's a 6. Oh, the painkillers are working. Big Pharma told doctors that opiates weren't addicted, right? So doctors fell into it, and doctors prescribed opiates to everybody because nobody was supposed to live with pain in the 80s. I can remember nudging my doc and going, does that mean you'll just give me a prescription for Tylenol 3s if I want it? I said, yeah. Yeah, if you need it, I'll give it to you. They were writing pharmaceuticals freely back in the 80s and 90s.
Yeah.
like freely. And now we have this huge opiate crisis that was created by our sick healthcare system, you know?
And I
So
watch clients die because of it, despite
yeah,
getting
yeah.
them off opioids.
But we were
Yeah.
supposed to be positive here, Sam. We were supposed to be giving you
Guys, yeah.
solutions.
No. This is great. You know, there's something that's kind of like clicking for me and settling for me that's kind of bubbled up from this conversation. I want to kind of like share with you what I have distilled from everything that you guys have shared, and I want to hear your thoughts on it. It sounds to me like the biggest challenge with cannabis as a wellness thing, as a medicine within the system that exists in Canada, is basically it doesn't play well with Big Pharma. Big Pharma has invested fuck tons into all their medicines and all their compounds. The whole system that Health Canada has expects there to be a single molecule that you can patent and whatever. I don't know what the correct terminology is within that DIN system you were talking about. And just cannabis doesn't play well with that. So a big pharma company can't create a DIN because it's a thing that you grow, and every single time it's different.
It's
It's from
different.
batch to batch, the same genetic, and it's not one thing. It's a whole entourage effect, like we said. And so, for there to be any chance to really have this be accepted within the system that exists today, there has to be this shift and this like second type of DIN equivalent that allows herbal based, organic based medicines to exist, and that's just like rejected because it can't be capitalized in the same way that big pharma can everything else. That to me
Yeah.
seems like the crux of the issue with you know, we're getting kind of away from stigma, but it's part and parcel. Like I feel like if big pharma could profit off this, stigma would go away super fast.
It's also
It sure as hell would.
it's also the ego of Western medicine. I mean, there's been herbs. I mean, the whole thing about herbs are medicine, naturopathic medicine, all that stuff is considered
Functional
alternative.
medicine. Yeah, functional medicine.
As
Because
opposed to
Western,
ancient and what we've used for thousands and thousands of years successfully medicine.
exactly. Yeah. No, and that's what I get a kick
Yeah.
out of, right? We call and we have this Western medicine and everything else is alternative. Well, my God, man, yoga's been around a long time and yoga can bring comfort to people, and calling it alternative medicine is
Yeah.
awful. Cannabis has been around. I mean, Queen Victoria used it. I mean, cannabis has been anybody who's listening to this podcast probably knows this already. Cannabis is around forever, and it was only, like you alluded to, Hearst and DuPont and the robber barons of the
Yeah.
early 1900s that saw the money they
Carnegie.
were losing, right?
Yeah.
I mean, yeah, but cannabis is a medicine for people, and I think health practitioners need to get on the bandwagon, because really there is no. Trevor will give me gripe for this. There's no downside to cannabis. You can green out and have a really, really bad day, man. Like, I don't recommend it for anybody.
There is downsides if you are like, predisposition towards bipolarism or schizophrenia or things like that. It can really THC. No, I
Correct.
THC. And
Yes. But there are some doctors using cannabis for mental health issues.
Yeah,
right.
totally.
And there's a small, and like Dr.
Or maybe
Russo,
Kirk, you can kind of say like, yes, you're almost saying like it's so benign, but it is so benign compared to what we have
in a harm reduction model,
yeah,
right? It's benign compared to what the alternatives are. Hyperemesis, hypercannabinoid emesis is Dr. Russo is suggesting that it might actually be genetic. Right.
Yeah.
So people that come in with, and so it's one of the big side effects. Oh my God, you're going to vomit forever. It's like, well, not everyone vomits from overconsumption of THC, and it might just be a genetic factor. So, like, I know that in the north, Nunavut, I've talked to doctors up north, and apparently there is a high number of people that suffer from hypercannabinoid syndrome.
Oh, so then you're looking at genetics within that population.
Exactly, right. So when you looked at cannabis,
is that syndrome that you mentioned, does that only happen when you consume too much, or is it just like you could just have a puff?
They don't really know is the thing. They don't know what the actual causation of it is. Is it pesticides in cannabis? Is it genetics? Is it too high a THC? They don't know.
Or is it 5 days of consuming high THC flower, and all of a sudden your body just, I mean, I don't know if any of you have greened out. when I greened out, when I had that one experience,
It's horrible.
it was awful. I felt like I was
Yeah,
on a, I was,
I had.
it's
I,
awful. So I
yeah.
can see how people would vomit over it. But yeah,
I guess where I'm going with my question is alcohol makes people vomit all the time, so it just seems like a double standard that like
alcohol
it goes
kills
back
you.
to the stigma thing. It's like, if somebody's like drank too much, oh, they just need to puke. It's like a whatever thing. It's just like they just drank too much.
Yeah.
So why I keep asking, does this only happen if you smoke too much? Where I'm trying to go with that is like, why is it any different? It's just like somebody
I
consumed too much of the thing.
my
Yeah.
understanding is it's overindulgence for a long period of time. But
Yeah.
some people can get it the first time they do it. Dr. Russo suggests it might be genetics.
Yeah.
It's funny though. I asked the doctor the other week, Janessa Wilson King, who will be coming up in one of
Oh,
our podcasts.
you've got to interview her. I've listened to her
Yeah,
speak and met her a few times. She's amazing.
yeah, she
Cool.
is she's a lovely lady. I'd love to meet her as well. She basically was saying that I forgot my train of thought. Sorry, I lost my train of thought.
I
she
I
wa-
wanted to share on. Okay, go ahead, Kirk. I don't want to
I don't
interrupt your train
remember
of thought.
I don't remember where I was going
Oh,
with it.
okay,
Carry,
perfect.
carry
We're
on.
too
Yeah,
excitable.
I was.
Um,
Yep.
just to giving an example, even from like a nursing perspective, when it comes to stigma, not necessarily from the client perspective, but nurses that have enrolled in my program are taking it and they're carrying around their cannabis, a handbook for nurses by Dr. Carrie Clark, to their, in their hospital jobs. The stigma that they receive from other nurses alongside them or doctors is disgusting.
Yeah,
They'll say, what are you doing? Like, you just like, how do you even learn about that? What, you guys just smoke around, like sit around and smoke and get high,
yeah,
and
yeah.
that's it? And they're like, whoa, shall I show you this entirely massive chapter about the anatomy and physiology of the endocannabinoid system? And so right then and there is that perception. And Dr. Linda Bellamy's study that looked at, Manitoba nursing students, what was their cannabis use like? And then also what was their knowledge like around it? She showed that those nurses that consumed cannabis had a much less stigmatized view when it came to patient care. But here's the really important part about stigma and patient care. Say you're a nurse that works in endoscopy, so you're doing colonoscopies for clients. You're thinking cannabis doesn't have a role to play in here. Who cares? Like, you should be able to completely ignore that. Well, a study came out that client needs about 40 milligrams more of propofol, the sedative agent, to get them through that procedure. But if that client feels stigmatized view from that nurse,
Oh,
doesn't feel
interesting.
safe. Oh, I'll send you the study.
Please do. Yeah,
if
yeah,
if if that we don't come in as a nurse that's doing that intake on that client without stigma, as we ask, it's not just, do you use drugs, alcohol, or cannabis? Yes, no. That's not sufficient enough. But right
yeah.
there, you're stigmatizing even in our intake in healthcare, because you're throwing cannabis right in beside alcohol and street drugs.
A
What if
substance
that's a
of misuse.
medicinal user?
It's a
Exactly.
substance of misuse. That's what
So
we're
why
trained
would
to do.
that client feel safe by
Yeah,
divulging to that individual that actually I use medical cannabis, I smoke this much, I take this much capsules, but we need to know that so that that client gets the appropriate sedation plan for their procedure. So right there, the
interesting.
line of stigma is that, and it's like studied as a good quality study done, that cannabis consumer, and we don't necessarily know the mechanism as to why. There's lots of theories around it and how cannabis works within the endocannabinoid system and brain receptors. But as that cannabis consumer moves through our medical program or our medical world here in Canada, say I'm going to do a conscious sedation in the ER.
Yeah,
But that client already doesn't want to tell them that you're a cannabis user because they don't want to have a stigmatized response.
yeah,
Then all of a sudden this patient's under sedated, and we are harming and hurting that patient while they're
yeah,
getting a procedure that any other patient should be getting and have proper sedation for.
yeah,
So
yeah.
already
So
with stigma is putting our patients at risk.
So again, if Sammy's asked us, how do we go forward? First thing we want to do is that if you are using cannabis, please let your doctor and healthcare provider know. I say this over and over and over again in the podcast. I personally, I have a wonderful family doctor. He's a wonderful guy. I met him 25 years ago. I see him once every 5 years to get my driver's license. As I get older, I'm seeing my doctor more and more. Well, I fell off my bike. I ride mountain bikes. We got a great mountain bike trail in Dauphin. Anybody who wants to come here, great elevation, great riding. I ride hard. and I fell off my bike.
Boost anandamide.
I busted 6 ribs. I busted all my ribs on one side, and I used cannabis for my medicine. I used it for pain relief. As I healed, I realized I'd blown out a shoulder. So I went to my doctor and I said, you know what? I want a CAT scan. I said, I want an MRI. I want to diagnose what I think I've got. And I don't want any opioids. I don't want anything from me. I'm using cannabis. And he knows me. I mean, of course, I got a podcast. He knows me. I've worked with him in the hospital when I was managing. I know he knows me. No stigma from him because he understands, but also no comments. And he never asked anything about how I used it. He just, okay, so I use cannabis for my pain relief, and I'm getting older, so I think one way to go forward is encourage people, talk to your doctor, even if your doctor doesn't care, at least let him know, because ultimately it's the health professional to educate themselves on this. Is and when you look at
And
any
Kirk, maybe it's telling patients to like talk in that language. If they
yes,
bring like if the like that's the empowerment piece from nursing, right? If the
yes,
Yeah.
physician comes back at them with a stigmatized response, you say it is actually your ethical and as per your college of physicians to
yep,
become educated on this because that response right now is rooted in stigma. If a
yes.
patient feels empowered enough to sit in front of somebody, a physician, and say that, again, there we're defying stigma because maybe that physician will take a step back for a minute and say, you know what, maybe I do got to learn about this. Or if they don't, then screw them and get a new practitioner, which is really
Get
hard anyways.
Well, which is very hard to do. That's why we need more nursing stations, right?
Guys,
We could talk about
we're
800,000 issues.
we
Sammy, this
we
has been great, man. Thank you for inviting us. This
you
has been
are
fantastic.
so welcome, and it's unfortunately I do have to say that we're pretty much at time here.
Mm.
Mhm.
Um, and what I want from each of you before wrapping up is just one or two sentences. What is like the most important thing that we can do to fight stigma in the healthcare system and result in a decade and 2 decades in a much more holistic reality? What do you think each of
Listen
you?
to my podcast.
Okay, so Kirk
It
says
helps.
go
It
check
helps.
out
It
Reefer
helps.
Madness. Reefer
I
Reefer
can
Madness.
Madness.
vouch.
Yeah,
That's
Yeah.
reefermed.ca.
reefermed.ca is the
Reefermed.ca. Now, what we need to
Um,
do? Go ahead. Go ahead.
oh no, Kirk, go ahead. You're
no, no,
just
you're on your train of thought. Go.
yeah. What we
What
need
we
to
need to
do.
what we need to do is we need to challenge the system, and we need to educate ourselves on the system. We currently work in a sickness model. If you want to be well, find a nurse practitioner. Nurse practitioners work on wellness models. Go out and research. I mean, you got Dr. Google. Find cannabis prescribers. They're online. On our webpage, we have access to online physicians. Find a physician, find a provider that will give you a prescription. If if you are going to use your cannabis as medicine, educate yourself. This was one of the notes I made myself. Is that if you're using cannabis as medicine, you should not be getting high, right?
Mm.
You should be balancing your endocannabinoid system, and if you want to get high, go get high. But if you're using it as medicine, you're not doing it to get high, right?
Yeah.
It's a different
You're doing it to
mindset.
get well.
To
And
You're
get
that's
doing it to
well,
get
and
well.
that's what makes this
correct.
whole just go to a rec store, get your medicine there so horrible because all the stuff there is meant to
Get
get
you
you high.
high. However, you can buy Sleepies, which is a CBD and
Yeah.
CBN concoction, so you can go to sleep. But so anyways, yeah, treat
But it's but, it,
yourself well.
but it's like less than 5% of what's available in the store
Yeah,
is things that won't get you high. Less than
yeah.
5%.
And
It's
if you're consuming cannabis recreationally, understand the entourage effect, understand the importance of the whole flower.
Honor the
I
plant.
honor the
Honor the
plant.
whole plant.
I'm an old guy. I'm back in the day before the pandemic where you pass the reefer puff puff pass. I still do it. Don't judge me. I get it. I understand why we're not supposed to do that anymore. But my immune system is healthy, and I don't mind sharing a reefer with you. Right? I like flower, and I understand flower. I don't take capsules. I don't take drops. I like my flower. I'm educated on it, and I do it with understanding.
cool.
And I
Thank
guess
you,
that
Kirk.
kind of like what I would say about it is trust your intuition, trust your body. Don't allow anybody else to tell you what your body needs. If I had trusted, if I hadn't listened to somebody telling me what I needed, maybe I wouldn't have been addicted to sleeping pills for 6 years and lost my baby.
That's amazing.
It's
That's an amazing story.
because our bodies are intuitive. We have an endocannabinoid system available to this plant. So we need to pay attention to what our bodies are telling us. And then that can allow us to sit there in front of people with stigma, be it regulators, doctors, whoever it might be, and know that we're speaking the truth. That in the end of the day, it's only us. It is the decisions we make. We are responsible for our health. It is up to us to take care of ourselves. And how we do that is up to us. And so that's what we're always trying to empower our clients to know, is that they're speaking the truth because it's what aligns with their values. That's what equals wellness, is when your life aligns into your values. Like Kirk talked about, when he worked in the system, it didn't align with his values. That equals ethical dilemma,
I got out.
right?
Mm-hmm.
Yeah, and you got out and I got out, right?
Yeah.
But is that I think this head down approach of one person, one issue at a time is valuable.
Yeah.
We don't need to be sitting right at the highest Senate and, projecting this from the rooftops, which hopefully one day we do, but we're going to get there one step at a time, one person at a time.
You go to your doctor and say, I got high blood pressure. He's going to give you a pill. When my blood pressure was high, I quit my job. I literally,
And
I went in, my blood pressure was
wellness
200.
model.
Well, my blood pressure was 210 over 120. That's not sustainable. I quit my job. I mean, because it was the job that gave me the blood pressure, right?
Yeah.
And so a little pill will fix it, but that's not wellness. So I quit my job and found something else. I'm employable. So I think that's right. Practice wellness, treat yourself well, and
Cannabis can be a huge part of that.
yeah, and live in community, people. Like live in
Yeah.
community. That's the other thing, is that we're not individuals. I mean, sorry guys, there's a whole generation of kids that think they're individuals. No, we live in community, and treat everybody well and treat everyone kind. What I like about the cannabis industry, or use the word industry, Sammy, it's built of kind people. Most people that are into cannabis, they're kind. When have you met somebody that hasn't been kind in cannabis? Like, I really seriously haven't. You
Well,
have?
in more recent years, with the kind of the corporate capitalist
Yes.
influences, the
But
money
they're not.
influences that have come in,
But they're
that's
not
really
cannabis.
changed.
But they're not cannabis proponents, right? I'm talking about
No.
people that live the green culture, that understand cannabis, that are advocates of cannabis, are experts of
Okay,
cannabis.
I see what you're
They're
saying.
they're
Yeah.
kind people. They're kind,
Generally
and
speaking, yes.
generally speaking, they're kind people. So
Yeah.
I love it. Just live in community, be kind to each other, and just give everyone a high five down the street. You want to make
Well, on
someone
that note,
uncomfortable? Yeah. On that
everybody,
note,
high five. Come on, Kayla, you're not going to join us? Yeah, that's right.
cheers, guys. This has been lovely.
Yeah, it's
Thank
been
you guys
great.
so much for being here. It's been lovely. Thanks for your little comments in the chat, Matt. Appreciate that. Next week, not next week, 2 weeks from now, on a Thursday, actually, it's going to be our first time doing the podcast on a Thursday because one of our attendees cannot make it on a Fridays. We have a
That's
very
Trevor.
interesting. It is Trevor. Yes, it
Yeah.
is. Reefer Madness co-host Trevor is one of the
Yeah.
guests, pharmacist that we were talking about today, and he's going to be joined by two real legends of cannabis. We have Ted Smith of the Victoria Cannabis Buyers Club and Hilary Black of the BC Compassion Society. I think is what it stands for.
Nice.
Compassion, aka the first two compassion clubs in Canada.
Yeah.
They have both gone on very different journeys. With Ted having the only remaining compassion club today. Hillary, quote unquote, selling out by joining Canopy Growth, which rubbed a lot of people the wrong way. But hearing her talk about it, it's very very interesting, her
Story, I'm sure.
perspective.
Sometimes you have to be inside the tent pissing out of it than outside
Totally.
the tent pissing on it, right?
Yeah,
Sometimes,
and that's a fantastic metaphor.
Yeah.
But yeah, so we're gonna have a conversation on medical patients and compassion clubs and
Amazing.
whether or not, just how do we move forward? I think it's a parallel conversation to this one here. It touches the same subject of patient care, but from a very different perspective. We're not going to be really focused on stigma so much as the Compassion Club model, Health Canada's intentional choice to ignore the Senate continues to tell them please talk to compassion clubs and learn from them. Yeah, I'm really curious to see where that
We've
conversation
talked to
goes.
Ted. We've talked to Ted 3 times. I think we've got 3 episodes with Ted. Great, great,
Amazing.
and also Owen as well. Anyways, you know what? I could keep you on here for a long time.
I need to pee, so unfortunately,
All right.
I have to stop this conversation. I don't know if you noticed me bouncing or not, but I've been like trying to
You've been
stop my
dead.
body from. I've
Sammy,
been
this is like a reoccurring theme every time
I'm
I
in a
talk to you
chair.
on a Zoom call.
Last time it was more apparent because I was standing up, so you could see me there. This time I'm bouncing in my chair, and I'm like
Okay.
deliberately trying to be still.
I used to
And
call
I'm
it the pee
hungry,
dance.
so okay,
I
and
used
I'm
to call it the
hungry,
pee
so we
dance.
need to
It's
have
the pee
wellness
dance.
now.
Kayla, we should talk, eh? We should get
Of
together.
course.
All right, man.
Yeah,
Thank you everybody for
absolutely.
being here. It was a pleasure. Thank you, Kirk. Thank you, Kayla. Appreciate the conversation. And
Anytime.
Peace and
until
love,
next time.
guys.
See you.